Hi, my name is Cindy. I'm a PTA with CORA Physical Therapy in Sebring, Florida. And September is Balance Awareness and Fall Prevention Month, and today I am going to speak about LSVT. LSVT stands for Lee Silverman Voice Treatment. Lee Silverman was a patient with Parkinson's disease, and her family was continually complaining that they could not understand her, and they had difficulty hearing her. She met Dr. Ramming in 1987, and Dr. Ramming headed the research team for LSVT Loud, which is the first evidence-based speech treatment for Parkinson's disease. LSVT trains people with Parkinson's disease and other neurological diseases to use their body more normally. And a couple years after developing LSVT Loud, they developed LSVT BIG, which was used by OTs and PTs. People with Parkinson's disease often have more difficulty with their gestures and their actions. They become very slow and they become very small. They have trouble getting around. They have decreased movements with other activities and with their activities of daily living. Parkinson's patients usually have hypokinesia, which is a reduced amplitude of movement. They have progressive loss of loudness of speech. They have progressive loss of amplitude of handwriting, progressive shortening of stride length and arm swing with walking, and decreased speed and amplitude during repetitive movement of fingers and limbs. LSVT BIG effectively trains and improves movements for activities like small motor skills, like if they're trying to button a sweater or button a shirt. They also have difficulty with large motor skills, like getting up from a sofa or getting in and out of a car. And LSVT can help improve the movements and self-care and other tasks. With LSVT, there are activities, there's the daily max exercises, and with those exercises, they can learn to make their movements bigger. And with that, when they feel like they're moving too big, they're actually moving more normally. Okay, along with the max daily exercises, there's functional capacity tasks and there's hierarchy tasks. So we're going to start with some of the max daily exercises, and I'm going to show you a couple of those, and we'll run through those, and then we'll touch base on some functional tasks. Okay, so I'm just going to move this out of the way, and we're going to come right into the first exercise we're going to do is a sitting exercise which works on sitting dynamic balance, okay? And it's going to be a forward reach. So we're going to reach forward, down, up high, out to the side, and then we count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then slap. It's really important for them to project their voice while they're doing big movements. This will help with their speech and with their larger movements. Okay, and this exercise is done 8 times, and you hold each pose for a count of 10. Now, if they have problems with fine motor skills, you can fine-tune that with finger flicks. And with finger flicks, you want them to be forceful. You want them to really flick those fingers, and that will help with fine motor skills. So we're going to come forward, down, up big, out big, and flick. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and slap. Okay, and that is the first exercise, and these exercises need to be done consecutively in a certain order. The next exercise we're going to do is a side-to-side reach. And with this exercise, you're going to put your palm up, out to the side, and we're going to swing like you're rolling a bowling ball. And with this one, you're going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back and slap. Now this also you can hold for a count of 10 with the finger flicks, which will also help with fine motor skills such as buttoning a sweater or a shirt. So again, we're going to bring our arm out, swing that bowling ball around, and flip. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back and slap. Okay, so those are the 2 sitting exercises. Next, we're going to get into standing exercise, which is really going to work on balance. Okay, so the first one is a forward step. So you're going to step forward with big movements and then step back. Step forward and back. And forward and back. Just really stressing those big amplified movements. Okay, you would do 8 on one side, 8 on the other side. The next one is going to be a side step, and we're going to step to the side, looking towards the wall, and back with a big slap. Sideways, big slap. Sideways, big slap. Okay, and that's the second one. Now the next one we're going to do is a backward step. This one, the hands are going to be out to the side. We're going to step backwards.
Okay.
Toe comes up and stop. Step backwards, toe comes up and stop. Backward step and stop. Again, this would be done on both sides. The next one we're going to do is going to be a rock and reach. So with this one, we're going to have 1 foot forward, 1 foot backwards. We're going to reach forward nice and big and back. Notice the feet are rocking, up on the toes, back on the heels. Up on the toes, back on the heels. Okay? All right. Now the next one is going to be a side rock and reach. So side rock and reach. We're going to swing forward and slap. Out to the side, rotate, and you really want to stress looking behind you and back. Okay, and then the next one you're going to do is you're going to sit down. And this is also a functional activity task, because with all the functional activity tasks, you'd like to select about 3 functional activity tasks, and this also can be applied to homework. But the number 1 is sit to stand, and that should be the first exercise with all functional activity tasks. So with the sit to stand, you're going to bring your arms up, and you're going to have them lunge forward to get their bottom up, and then stand up nice and straight. And then come down, and they're going to lunge forward, come up nice and straight. Okay? And then down. Up, and then down. Okay, now those are the major exercises with LSVT. You want to have functional capacity tasks to give them for homework, and with functional capacity tasks, like if you pick sit to stand, you can break them down into hierarchy tasks. So they may not get the full activity of swinging and coming all the way up at once. So what you might want to work on first is just having them swing forward and get their bottoms up off the bed. And you can break it down into smaller segments so that they can get those tasks. Okay, so with the LSVT program, they have to be performed by a certified therapist. And the program is 4 times a week for 4 consecutive weeks, which is a total of 16 treatments. Okay, and then Along with these, you can also work on other activities. You give them daily homework. You can time them buttoning up their shirt, and then every time you do a progress note, time them again and see how they're getting better at it. Okay? Basically, that is the LSVT program. And if you're interested or need any, have any questions about LSVT, you can contact your local CORA physical therapy office, and we'd be happy to help you. Thank you for joining us. Bye.